It's very difficult to say just one change, but I think fundamentally it's about a focus on families. So I think sometimes, particularly with the health service in the past, too often it's been a focus on individual patients. But we all live our lives in other networks, in families, with friends. So the way in which both health and social care can support families to care for each other, to recognise often that families and carers are real experts in somebody's care. So although there are many issues to tackle, structures, funding, all those sorts of things, I think the cultural change is going to be the thing that brings the biggest benefit. Well, I don't think there's just one boundary between health and social care, because it does vary up and down the country. So certainly I know areas where there is really good joint working, where those boundaries feel almost like Chinese walls rather than big boundaries. And there are others where maybe it feels like it's a much more difficult thing to tackle. I think one of the key issues is maybe looking at the role that local government has, which has a very clear duty to promote the well-being of its population. If the NHS had a similar duty to promote well-being of the people it's serving, including families and carers, I actually think that would be very helpful in getting a joint sense of what health and care is there to do. The funding question about whether it should be integrated between health and social care is quite a tricky one. There are flexibilities that already exist, and certainly in some areas you see local government and the health service working together and pooling funding and thinking about how it can provide services in a different way. I think the key thing is actually that whatever the funding mix is, that there is enough focus on funding for preventative support and support that enables people to give their independence. So too often we see a situation maybe where investment in one area produces benefits in a different budget, and therefore there isn't that collective will to make it happen. So we need to find a way of making sure the right incentives and levers are in place in the funding mix. The voluntary sector has a huge role to play in providing health and social care. It's done so for many years, indeed for centuries, and I'm sure it will continue to do so. I think it has a unique role, both as a provider and a champion of those that it serves. So I think that combination of developing services, providing good quality services, and at the same time being a voice, being an advocate, being a critical friend is really important, because it's not just about the services that are provided, it's about listening to people's experience of that and listening to what is going on in the rest of their lives, because we don't just exist in the health and care world. We have issues around work, we have issues around benefits, we have issues around our housing. And I do think the voluntary sector has an important role to play in seeing the whole person,